I mean, I'm told that I need to introduce myself as chair, so I'm Peter McCabe. That's for the benefit of the people that are listening from home. And I'm Peter McCabe. I'm the Cabinet Member for Health and Adult Social Care. And we really do have a packed agenda tonight. There's a lot to get through. So I would ask that anyone who is speaking sticks to their time, and that questions are succinct, and that if people want to make speeches, they keep them short and snappy. And let's try and get through the agenda in good time. Now, item 1 is apologies for absence. We have apologies from Bev Hendricks, from Carla Finnekin. Oh, you are here. So why did I? No, I'm sorry. I've misread my brief here. So Carla, you're very welcome. Is this your first meeting? Right. Good to see you. John Morgan has given his apologies. And are there any other apologies that we've received late in the day? No. Okay. So the next item is, sorry, have you got the agenda? I haven't. The agenda on the screen. Agenda, there it is. Yeah. So minutes of the previous meeting, they have been circulated. Are they agreed? Happy with them? Good. Great. Fine. Oh, actually, we should have done. That's what I was looking for. Declarations of pecuniary interest. Are there any declarations that people wish to make? No, that's good. So the next item is the Merton Better Care Fund Q3 report, and Mark has very kindly agreed to talk us through this.
Thank you very much. I'm Mark Crone. I'm the place lead for Merton at the Integrated Care Board, the ICB. I'm here on behalf of Terry Clark from the council, and my own Sarah Rushton, who are unable to come tonight. I'm not the expert on the Better Care Fund, so do excuse me as I muddle through their presentation. I'm going to take the presentation as read, though, and just remind people that the BCF is really a broad range of activities, interventions and services which really enable people to be supported at home through reablement, through a range of different services. And the pack actually does list out the full range of services that it covers. It's £26.8 million worth of investment. It's a really key investment mechanism for us, working jointly and working in partnership. And we are judged on 3 metrics. One's the reduction in non-elective admissions, emergency admissions. One's discharged on the day that you were supposed to be discharged, and then admissions to nursing and residential home. We bring this on a very regular quarterly basis. This is just the update for Q3. And just in terms of how are we doing, so actually for discharge on discharge ready day, we're on track, as we are with admissions to nursing and residential home. For those that are reducing hospital admissions, we're off track with that at the moment, and we've seen an increase in hospital admissions. But we've got a range of activities that are now in place to try and address that and support people staying at home or being seen by community and primary care services rather than being admitted to hospital where appropriate. Yeah, you know, there are some hospital admissions that are absolutely appropriate. We are looking at virtual ward, our urgent community response, and the ICB has just identified £150,000 to invest in non-elective admissions and the reduction. So that's going to be the kind of key focus, certainly for not just the BCF, but also our alliance partners, of which we've come together as a partnership. The reduction in non-elective admissions is the key metric and the key driver, certainly for the next 6 months. I'll stop there and take any questions, if I can.
Thank you, Mark. Are there any questions? No? Okay, well, we are asked to note the report. Can we note the report? Thank you. So, the next item is item 5, which is Healthy Places Actions, Dashboard Outcomes, Next Steps, and Health and Wellbeing Input. So, Jeremy, you're going to kick off, but there are a range of speakers covering many of the segments within the report, and if they can introduce themselves when they start, and let's have enough time for questions, please. So over to you.
Great, thank you very much, Chair. I think so. Just by way of introduction, I'm Jeremy Smalley. I'm the Executive Director for Housing and Sustainable Development for the London Borough of Merton. And I'm the Senior Responsible Officer for the Healthy Places theme of the Health and Wellbeing Plan. I think the first thing to say is I was fortunate enough to come to your January meeting and hear the discussion and debate that was had in January and reflected on that. And I'm really keen to ensure that we recognise as a council and council officers the importance of the Health and Wellbeing Board and what potential it has got to make changes and improvements in the life of residents. So we thought what we'd try and do today is do things a little bit differently. And we're really keen to engage board members in our updates. So I know when I came in January, I did a quick snapshot of Pearl and Dean, as you called it, which has stuck with me. I think that was a very good phrase, sort of an entree into what we might discuss. And the board seemed interested in all 7 priorities. So rather than focus on 3, I thought we'd just do a snapshot of all 7. And the format that we're going to take is we're going to present what we have done and what we intend to do next to meet your priorities. But then what we're really keen to do is have a discussion through yourself, Chair, with the board members about what can people on the board contribute through their organisations to help us meet those priorities going forward. So I am joined by a range of colleagues who are going to talk to various sections of the report this evening. And I think the first thing is public health colleagues are going to talk through the Healthy Places dashboard. So great, if I hand over. Thank you.
Thank you. I'm Helen Raisin. I'm Associate Director of Public Health, and our team does the dashboard for the whole of the health and wellbeing strategy. If you look at the screen, you can see on the left-hand side, those are all the different chapters or priorities of the strategy, and we're on the Healthy Places one. Now, because such a wide range of factors affect people's health in terms of place, we've only been able to capture a couple of indicators here, but just to give you a quick overview of those. The first one is around employment, and we track the 16 to 17-year-olds not in education, employment and so on, and you can see from the graph, and it's quite hard to tell, but Merton's the kind of dark purple blue at the bottom, and the colour is similar for all the other graphs too, that this level has been reducing slowly, and that's what we want to see, and thanks to the hard work of colleagues who may speak more on this shortly. And we're also lower than London, so going in the right direction there. The next one along in the middle at the top is air pollution, and this is fine, it's particulate matter and its mortality from particulate matter, so it's slightly modelled, and this shows again that we're at 6.4%, and you would expect urban areas could be up to about 8% attributable mortality to particulate matter, and rural areas tend to be more around 2%, so we're very similar to the rest of London, slightly lower. but we should continue to reduce this. You can see it's reduced a bit over time, which is good. And I think there was some action on air quality a few years ago that the Health and Wellbeing Board, is that right, was leading on, so that might have contributed to that as well. The third one on the right at the top is a new indicator we've put in around homes with damp. Again, this is modelled. It's modelled for all homes. It's quite a complicated way that the Office of National Statistics have done it, but again, it shows about approximately 4.6% of homes with damp. A colleague may say more about that later. And along the bottom, we have the percentage of adults walking for travel. I probably ignore the dip in the middle because that's COVID, and I'm not sure how reliable that would be. But we've seen an increase in this in the most recent years, and that increase has been it's been quicker. I don't know if Richard wants to say something more about that, but it's been quicker in the recent years and quicker than Southwest London as well, so that's good. And finally, an indicator on the right in the map, which we see regularly. This is showing deprivation across Merton. Deprivation is a big contributor to health, and often goes alongside some of the other indicators varying through across Merton as well. So in general, our indicators are positive and we're moving in the right direction, but there's more to do, and I'll leave it there.
Thanks ever so much.
Thank you.
We move on to our presentation on the first action. So I'd like to give thanks to Tara and Richard, who are going to take this first item. So over to you.
Thanks, Chair. So this first action should be looked at really closely with the second action as well. First action is really more around the environment, creating the physical environment to bring forward the second action, which is involving all of us as partners and community groups in making sure people are supported in leading healthier lifestyles. So as Jeremy said, the way we're approaching this is to look at what we've achieved so far. Broadly, some of the things we've achieved in creating healthier environments are in getting the development industry to work with ourselves. So that could be developers, it could be parts of the NHS, it could be ourselves as a council. So when we build new things, we are embedding these matters in the physical environment, which will help to deliver subsequent actions in this. I am going to pass over to my colleague Richard Lancaster to talk about the transport and travel implications here.
Cool. Okay, so Richard Lancaster, Transport Planning Manager. So I'm going to touch on the slides on active environments and active travel. So first of all, I'm just going to say there's lots of work to be done in terms of the active travel environment. I'm not going to sit here and say everything is perfect. To make our highways, to make our parks, to make our green spaces attractive for walking, wheeling and cycling is a challenge. There are concerns, and we've recently undertaken a large public consultation as part of our walking, wheeling and cycling strategy that I'm going to come on to. But there are concerns around road safety, personal safety, issues around traffic volumes, challenges with our town centres, particularly around our gyratories, even challenges around our topography of some parts of our borough. However, we are at the moment in a positive place. At Cabinet next week, the Council's walking, wheeling and cycling strategy will be presented for adoption. And this sets out our strategy for the borough for the next 10 years. And alongside the strategy is a healthy capital funding contribution towards active travel. So looking forward, things are looking very positive, but also sort of reflecting back on what we have done. There has been some really positive changes that have taken place in our borough with regard to active travel. So a couple of examples I'm just going to mention. Across the borough, we have 3 kilometres of segregated cycling facilities. Some good examples at Plough Lane, also Merton High Street connected into Cycleway 7 that runs into central London. We really want to do more. Segregated cycle facilities are expensive, they are impactful, but we've got some really good examples. So 3 kilometres is a good start. This year in 25-26, we have installed 5 zebra crossings across the borough. So typically every year we look to improve our crossing facilities, addressing issues around pedestrian severance, which are really important to make people feel confident when they're out travelling. Also in the calendar year 2025, we have installed 72 cycle hangers across the borough, taking the total to 120, to more than 120. So again, really important if we want people to travel actively, to use our active travel environments. It's really important that people have access to cycle parking, and the cycle hangers do that. They provide cycling facilities for people who don't have space within their property for cycling. And the final example I was just going to mention, we've introduced 340 e-cycle hire parking bays across the borough. So again, provided the infrastructure to enable people to travel by sustainable modes. Appreciate the e-cycle. E-cycles are potentially quite controversial. They're controversial for all boroughs. They do have challenges, but the usage is amazing across the borough. In July 2025, we had 200,000 trips undertaken by Forest and Line bikes. So the usage is having an amazing impact on the way people move. Yeah, so they're just some examples I wanted to reflect on. If we just jump onto the next slide, in terms of what we want to do next, of course, as I've touched on, adopting the Merton's walking, wheeling and cycling strategy and implementing the actions within that are sort of a key next step priority for us.
Just to finish off there, I think, as Jeremy says, it's really about a little discussion about what we can all do together. This action is more for organisations with physical space and infrastructure. So you'll see the second bullet point there asks if your organisation's a landowner and you're building something, please support and promote active and healthier development. That could be providing cycle hangers, it could be providing showers or spaces for staff to change, it could be providing access to community toilets, all sorts of things that we can do as organisations that have physical facilities. And the other two, first and third bullet points, will really be covered under Action 2, which is about how we can help communities in taking these actions to make it.
So we were really keen at this point, Chair, to hear from board members about what they think about what's been achieved so far under this strand, and what would they like to see next, and how do they think they can contribute?
But one thought that occurred to me, and maybe if I was just wondering, we Mark and I had a conversation yesterday about NHS property services, and when I heard the mention of if you own land, can you take these issues on board, and is there a mechanism by which we can do that, and is there a mechanism by which we can ensure that the trusts that operate and provide services to the borough can get that message and build it into their planning, Mark?
I think the simple answer is yes. I think it's just actually linking up the trusts and property services with yourself. Yeah. And I think they would be very supportive of it. Yeah. So we can absolutely offline kind of do that linkage.
There's a positive action immediately. Have others got some suggestions or points that they think we should be looking at going forward, Tony?
It's really quite a point that it's come. I'm a bit surprised really about it, but when we're considering these spaces and how we use them, we've done quite a lot of research as part of our strategy, and what we've found is that older people and younger people, so both ends of the spectrum, are reluctant about occupying public spaces. I think fear of attack or antisocial behaviour. And I think when these spaces have been designed, if they could be designed with that in mind, I think it'd be really useful.
When you've done this work, is that a fear, or is it, I mean, because one of the things I hear again and again is that Merton is the third safest borough in London. So is it people's do people's concerns come from what they read or what they experience?
I think with younger people, there is a concern really around knife crime or being attacked or whatever, and that came out through some work we did at Tooting and Mitcham last summer. With older people, it's harder to understand because it's just feedback we've received, but you know, quite often, as you say, the perception of what's out there doesn't match the reality. So it could be around just providing assurance, but it definitely came up 2 or 3 times in the work we were doing.
Yeah, I mean, that's really helpful feedback, because if we're really serious about getting people more active in the public realm, we do need to address that. People need to feel that it's public realm and they're part of the public realm. So in terms of active travel, and Tara, in terms of the spaces, I think we need to have a think about how we can finesse that, really, to start addressing that very particular point.
Thank you. Just to come in on this, the same point, that applies to other groups as well. So you might find that ethnic minority groups have some concerns about using spaces. And quite often when spaces are designed, some of the behaviour research shows that if people don't have the capability to use that, they're not strong enough to, or fit enough in the first place. If they're not motivated by feeling safe, for example, those things all have to come together. So I think there's some sort of behaviour change work we could do alongside the design work.
It's interesting. I think behaviour is a prerequisite, and actually a lot of people we've lost those sort of almost codes of conduct for how to behave in public spaces. To be really keen to think about how we could perhaps talk about what we could do to nudge behaviours in a different way. That's useful. Thank you.
Ask Osama to come in. One thought that occurred to me was the importance, and I'm sure you're going to refer to this, of establishing practices and behaviour early in life, because if you can do that, then you know you've got something to continue, one hopes. One of the pleasures of living where I live is that on a Sunday morning, when I take my dog around Figs Marsh, there's a junior sort of fun run going on, and you know there are some kids that are a bit older, but there are also some very young children who sort of run around. There are adults that organise it on a voluntary basis, and it's just pure joy to watch the kids of all these different ages, come rain or shine, out enjoying themselves. And I'm not sure that that's something that is going on elsewhere in the borough, but that's maybe my ignorance rather than. So I'd be interested. But also, I know that when I visited Cranmer School a while back, they had a track marked out, and they were encouraging their children to walk in. Is it a mile that I mean, they've got lovely grounds there, haven't they? And so those are the kind of things that I'm sure our friends from and colleagues from children's schools and families will be able to tell us what they're doing, what they have done, and what they're perhaps planning to do. And I suspect Osama was going to in that direction anyway. So no. Well, the floor is yours.
Thank you, Chair. I was actually just going to ask for information around the concerns and that people have raised and the statistics behind the concerns that have been raised. And the reason I want to see more data and information about this is because we know that statistically speaking, Merton is a relatively safe borough, but I know for some of our community groups, there's been a disconnect between what the statistics say and how people feel. And so I would like to see the information and statistics behind what you've just shared, Tony. So we know whether we need to address a real issue within our public spaces, or we need to address a perception of safety issue within our public spaces. And speaking specifically about our younger residents, we've got a children's trust, as I'm sure many of you around this table are aware, which has set out priorities which were crowdsourced from groups of young people. And one of the issues they did raise is, yes, we want to be able to use public parks and public spaces, but they also wanted them to be safe. And that was more speaking to wanting to feel safe in public spaces rather than identifying an actual threat in the public spaces. So I'll just like clarity on what the actual challenge here is that we need to address, so we're not just acting on a series of assumptions.
Chair. Thank you, Osama. As I said, the information I relayed was back from really feedback from work we did with different groups at different periods of time. And I think no one can dispute that Merton is probably, I think it's the second safest borough, isn't it? Oscillates between 2 and 4. And I think you're right. I suppose the point I was making was that we should be mindful when we're designing spaces for young people and older people, that they feel welcomed into those spaces. And I think at inception, it's a really pivotal time to do it. I'd also sort of point to the fact that Merton's done a lot of good work in terms of, you know, building new communities, building new housing, providing new housing, all of these different things. And it'd just be a shame for that just to be missed. I'm not saying it would be missed, but I just wanted to draw attention to those two groups.
Okay.
Okay, so on cycling, so some feedback. I can see how difficult it is to get the segregated cycle lanes in. There's only certain roads that are likely to be able to take it. Locally in Wimbledon Park, the area I'm representing, there's a lot of criticism of the plough lane area that's been put in because hardly anybody uses it on a bike. So, you know, it's a difficult balance to achieve. We've also got a park where there's no bike racks in the park in Wimbledon Park. So you could cycle there, and then people are cycling along the pedestrian walks, again making it dangerous for the people wanting to walk around the playground areas. There's people on bikes, and even though I've asked for some signs to go up saying no cycling, they still cycle. There's no enforcement of that. It's very dangerous and very difficult. But I think, and I've just been to Harris Academy this afternoon as part of their career thing. There were nowhere near enough bike racks just outside the school. So I had to find somewhere to park nowhere near where I was needing to go. So all these things do need a little more kind of attention, and possibly also kind of selling what we're doing to residents so they understand it a bit more. One other point, the cycle hangars seem to be going in some very, very expensive rows with great huge houses that have probably got 6 sheds in their back garden, and still we're putting in a cycle hanger. And I'm thinking, wow, that's a strange place to put one. But it just happens to be a place that's a good place to put a cycle hanger, but it's not as if it matches the need locally. So there are some challenges for us to balance the places we can put stuff with where it's really needed, and then also communicating with residents about why this is happening. That's the feedback from my patch.
Yeah, thank you for the comments. In terms of the specifics, I'd be more than happy to pick up some of those, particularly around local destinations that do need cycle parking. That's certainly something we can certainly look at if it's not on high. We have the ability as a council through our Transport for London funding to put cycle parking in highway locations. That's certainly something we can look at. But if it is off highway, again, I can pick that up with colleagues and we can look at those issues, no problem. Just in terms of the question on the hangar, cycle hangers. So typically the hangers are demand led. So there's a database of people who are interested in hangers. So we've got a long list, and we've got a long waiting list. So typically the majority of the hangers that do go in are based on demand in that area for them.
To respond to Tony's point about enforcement, and when we are trying to separate cyclists from pedestrians, I mean, I see immediately a problem, because you know, the reality is that some cyclists, whatever you do, will I mean, go back to my own area, when I'm walking on Fix Marsh, there's one part of a path that is reserved specifically for pedestrians, and there's a road parallel to it, and there are signs saying please use the road, and the road is really quiet, it's residential, there's very little traffic, you know, people going in and out to come get to work or school, but they just, it's more in a straight line to go on the path, and you get mowed down, and there are kids going to school, and you know, I often say to people, you're supposed to, but by the time I've got the third word out, they've gone past. So how do you actually enforce that? I'm not about to step out and grab their bike, because you know, I don't think that's my role, but and I think anyone doing that would have the job. And you know, we've seen some of the really famous accidents in London involving cyclists, where people have been seriously hurt or indeed killed, and it's about people just disregarding the law and not being considerate. But is there anything we can do there?
Just coming back, my answer won't necessarily help a great deal here. It is a challenging issue. Okay, it's not just a Merton issue. This is an issue everywhere. Then there are some. If there are some sort of local concerns, there are issues we can look at, and there are some measures we can take. So we can put up signage to encourage sort of cyclists to use the route that they should be using. At times we get a lot of comments around shared sort of cycle routes, and again we can put signage up saying, as an example, share with care signage, to try and make sure that cyclists, you know, do acknowledge that they are on that route with pedestrians and need to take care, need to slow down. But it is a challenging issue, and I think Anthony's going to say a few extra words.
Yeah, thanks, Richard. The only additional thing I was just going to add as well is, yeah, it's a modern challenge. So we've heard about how, you know, brilliant the inclusion of e-bikes is, but also just around, you know, speed and the way that they're accessed. So particularly for our parks, where we've got some known hotspots, we've been putting in mobile enforcement officers just to try and stop some of the particularly bad behaviour. So it's a finite resource in what we can do, but it's probably the most effective thing we've seen in terms of changing behaviour straight away, or at least limiting some of that behaviour. So that's something we're beginning to considering more. Also kind of strengthening up our bylaws within the parks and open spaces as well. And a bit more around enforcement that we're working on as well. Actually, one of the things as well around public open spaces, which we get a lot of concerned residents from, is around dogs and dog control. Yeah, so bringing in further measures around that as well.
Yeah, I was just going to say, because this is a partnership board, and going back to Jeremy's original question, it was an ask of us of how we're going to support. So it's just in terms of public health behaviour change, but also I think there's opportunities for MEC making every contact count. So if there's information that we can build into our contacts, our routine contacts and health's routine contacts, I think that will really help in terms of getting people more active and certainly more aware of what's on offer. Thank you.
I was just going to make another suggestion as well. We're doing a lot of work, aren't we, now, on integrated neighbourhoods in terms with health, and we're in quite early days of talking about how different NHS providers and others work together, and maybe to do a bit more thinking in that space, because active travel and well-designed neighbourhoods are really important to prevent people from becoming ill, and maybe we should think about how we could build that conversation in a bit more to those discussions. I'm looking at a couple of colleagues here.
Okay, so shall we press on, Jeremy?
Yes, thanks, Chair. So if we move on to action 2 then, and Anthony and Richard are doing a double act on this one, so thanks very much.
Tandem on this one, so I'm going to start and then hand over to Richard. So just in terms of just reflection on some of the outcomes we've achieved so far. So we've launched our Borough of Sport initiative, which is, you know, quite unique for local authorities at the moment, being one of the kind of 3 key council objectives, and those missions that were originally agreed in 2023 summarised around those key 3 points around everyone in Merton, no matter their background, having the opportunity to be active and active sport and physical activity. You know, Merton being the natural home of sport in London, protecting, preserving and growing our sporting heritage, and having a thriving sports and leisure economy that benefits the local community. So in terms of those initial missions, we've developed working, you know, I mean, the whole thing is really working cross community, cross sector with different partners to really deliver a range of different activities and events that are either free or low cost that enable people to engage with sporting opportunities. And one of the big examples around what we've done within that is our which is currently actually out for bids at the moment, is our annual Borough of Sport grant, which is putting money into local sporting organisations to develop new access and activities, and very much going back to those original mission statements and focusing around key priority areas. So children and young people, residents over the age of 60, women and girls as examples of being prioritised groups. And actually, when we were talking previously about some of those barriers around access to public spaces and parks and open spaces, sometimes it is those kind of first steps in around encouragement and access into those spaces. So, for example, one of the things we tapped into is our women's running group, which is around addressing you know, safety amongst women in terms of running and accessing parks, as an example of how we can encourage people to become more active and more engaged and feel that their public spaces are more a place for them. And what we've seen is some significant increases in participation in sports and exercise. So these are quite significant increases within the Active Lives survey that's conducted both for children and young people and adults, and kind of the headline there is 6,800 more active adults since the Borough of Sport initiative started. And obviously, as we've been talking about space and design and places, we've been very much around levering in additional investment and external investment into our spaces. So £2.6 million and counting has been invested into public sports facilities. This is including the refurbishment of all of our public tennis courts in our parks, plus investment from the Football Foundation into what are termed play zones, which for those who wouldn't know what that means, it means basically a kind of a new version of multi-use games areas that are being installed as we speak in 4 of our parks. Over to Rich.
Thanks, Anthony. As mentioned previously, there is some overlap between actions 1 and 2. Infrastructure investment is key to increasing the number of residents who are physically active. So I just wanted to draw on just a couple more examples of some of the work that has been done in terms of physical changes to increase physical activity in the borough. The first example is just around school streets. So I know we were talking a little bit earlier around some of the work around schools. So 72% of Merton's primary schools are part of a school street scheme. I'm sure most of you know what a school street scheme is, that during the morning and evening peak period around school time, general traffic can't pass through that area. So active travel is prioritised, and this is really important. This is we've got one of the highest percentages in London, and it really reinforces good travel behaviour at an early age for families and children. The second example, and there's a bit more information on the slide that I won't go into too much detail now, but we've also made some really positive improvements around our parks and green spaces in terms of promoting active travel. And I just used the example here of the Wandle Trail. It's generally been incremental changes that have made improvements over time, so not necessarily changes you will see and think, wow, that's amazing, but improvements to bridges, widening of paths, improving lighting, addressing issues around maintenance. All of those changes make those spaces much better. And again, these are really important spaces for our communities, for our children, and for our families, and get so well used. So just a couple of physical examples, but also I wanted to touch on some of the non sort of physical changes that we've made. So there's also a lot of work, and again we've touched on it now, around sort of training programs. So for our schools, we have bikeability, so cycle training programs, and over the last year we've trained 1,500 children across Merton. At year 6 age, you receive cycle training. So again, really important for them in their development in terms of encouraging good behaviours. And we also trained 400 children over the last year to make sure they feel more confident cycling. So again, really good changes. And finally, just on schools, 19 of our schools now have what we call Travel for Life accreditation. So this is a Transport for London accredited scheme where schools undertake a number of initiatives to promote sustainable travel. The example you mentioned earlier about having the running route around their playing field, the 1K running route, things like that, maybe some of the initiatives that the school have been undertaking to achieve this accreditation, which is seen sort of very positively, in the school get credits and they get extra resources for doing that. So 19 of our schools now have achieved that. So lots of really positive work going on. Yeah, just generally promoting active travel.
And then just on what we want to do next, so very much it's about embedding the work that's already been developed around the Borough Sport offer and obviously continuing to stretch that. The interesting thing, actually, what Councillor McCabe raised about the park run, the junior park run at Fix Marsh. There's two currently that operate in the borough, so it's Fix Marsh and Wimbledon Park, and we're just working with Park Run to develop a third one in Morden. So there's further work on that, as well as with the schools actions that Richard outlined. Also, what we've seen even within the few years that we've been operating the Borough of Sport is that those priority groups and stakeholder groups change, and there's a change in terms of, you know, where those activity levels are. So it's really important that we continue to monitor that and work as a whole system around those priority areas and feeding in the data and the knowledge and the information to shape that. Also as well, it's very much around the physical assets in the borough. So we recently had our playing pitch strategy for the borough agreed by Cabinet, which sets out the kind of demands on sporting facilities and provision in the borough for the next 15 years. And there's quite a significant level of facility inclusions or additions that will be required to meet most of the kind of demand within the borough. And it's that kind of thing, isn't it, where you're actively engaging more people to be active. There's also going to be a demand for more facilities. So what that gives is a really good strategic rationale around sports demand by the areas of sport, but then also the kinds of pitches and facilities that are required in that. So, you know, things which are included in there is the play zones, which I reference, new artificial grass pitches, the new sports hall at Morden Park as another example, and other sports facilities improvements across the borough. And the final thing is just going back to that impact element as well. So produce some data before, but what we will also be what we are in a process now working with London South Bank University, producing an annual report around the Borough of Sport and the impact and the data, and that works in absolute conjunction with public health colleagues around that. So it's using that kind of approach around the annual public health report to kind of just put a particular lens on active usage and sports. Back to Richard.
Yeah, thanks, Anthony. So in terms of next steps with active travel, it's very much, as I've mentioned, focusing on the council's walking, wheeling and cycling strategy and taking that forward and delivering the 50 actions that are included in that strategy. Again, for now, I won't dwell too much on this slide. I've just picked out some of the key actions around our green spaces as an example. So there's three key actions there. But in terms of sort of moving forward, again, it's the combination of focusing on the physical changes that I've mentioned. I've used some examples today, but also very much around the training programs. So I mentioned the cycle training and the initiatives around behaviour change, which I haven't touched on so much today, but are in the strategy and are very important moving forward.
Thank you. And just kind of a few questions and open up the debate really, just in terms of how health and wellbeing members can assist. Is, I mean, firstly, just in terms of, are there unidentified gaps or areas of sports provision or underrepresented groups? Champion the borough of sport offer and what is available in its current approach, but also how we can further develop that in the future. And also, I think really important is around consistent messaging and talking to stakeholders, language around what we use, how we're explaining things, and how we can get those kind of key messages across around you know, physical activity development, sports facilities in the borough. And then also just finally, just identifying potential opportunities to collaborate on projects that promote the health benefits of walking, wheeling and cycling. Yeah.
Okay, I mean, can I just ask Mark again? I'm sorry if I appear to be picking on you, Mark, but what I'm thinking is the working in neighbourhood teams is going to provide an amazing, fantastic opportunity for this kind of work to encourage GPs and their teams to get involved and to see the benefits of having patients take up some of the opportunities that are either already there or being developed. Are there mechanisms for getting that information into the practices and amongst practice nurses and all the people that work within GP teams these days?
So the quick answer is yes, but I do think integrated neighbourhood teams are very they're kind of at their infancy, so we're developing them at the moment. Yeah, but they are a real opportunity to not just think about a prescription and a home care package. It needs to be a much wider kind of holistic provision within those neighbourhoods. So I think as we develop the neighbourhoods, we must actually think about activity, etc., and how do we ensure that people are referred into or can access it easily locally. We do have things like social prescribers, we do have things like care coordinators who have a kind of full range of the voluntary sector organisations and initiatives that are available to them. So I'm probably looking at Karen, you know, quite a lot of that work already goes on from a GP surgery. But is it systematic, and is it kind of completely accessible? There's work for us to do, and I think the integrated neighbourhood team space gives us the opportunity to kind of really embed it.
Thank you. And thinking about the biggest health gain is converting people to being inactive to doing a little bit more, and the huge opportunity that we have there in making that step from doing nothing to be slightly more active is active travel. That's the biggest opportunity for us. And to support Mark here, so David Gentles in the team and I earlier today presented at the Pan London conference on NHS Fit for the Future. And the purpose of that event was to mobilise and activate the NHS to support physical activity across the capital. One of the keynote speakers, apart from David and I, was the Chief Nurse for London. So really talking about the health gains that we can get from that. Thinking about how we activate the NHS, active hospitals, active practices, to really make sure that we are taking that making every contact approach to health and care. So we have trained our social workers within the borough to be having those individual conversations. and then thinking about Russell's annual public health report, Merton on the Move. So that has enabled us to identify the funding, working with the NHS again on a post that's going to be able to push forward as we move forward, working really closely with our NHS colleagues.
And I see your hand up.
Yeah.
Sorry, Karen.
Yeah, thank you. Yeah, I agree with obviously what Mark and Barry have just said. I mean, I think as we develop our integrated neighbourhood teams, I think prevention is one of the key pillars of how we're going to be working in the future. So obviously this fits in well with that. In our practice in PCNs, we do have access to our social prescribing link worker. So one thing I was reflecting on during the presentation was how we ensure sort of a live sort of repository for all of the information, because there is a lot going on there. But I think the difficulty is often as a frontline practitioner is actually being aware of what's available, and so that we can pass that information on and signpost people accurately. I think our Family Hub offer as well, I think I've already seen some really good work that they're doing around signposting and prevention. So I guess it's how we bring it all together so that it's sort of at people's fingertips at the point they need it, because then it's definitely going to be used. I think if it's a sort of clunky system where you've got to go searching for it, often the sort of moment has passed. So I guess that's what I'd be wanting to think about as we develop our integrated neighbourhood teams, how we can make it easy for professionals and other people helping patients to find the information, and also for people to find the information directly themselves.
Thank you, Mark.
And just building on what Karen says, because it's not just referrals, is it? It's just not referring to another organisation. It's as Barry was saying, it's also about how in a contact you can embed a conversation that encourages activity. Yeah, and that's not just about GPs, that's about all our community services and actually the hospitals, you know, again, having you have to train people to have those conversations. You have to make it part of their working day, don't you? So we need to think about actually how we do activate that health input, so that actually the consultation or the intervention is done in a different way.
One of the things that when Anthony was talking, a really strong memory that I've got is going with you to Pollard's Hill Library, where we saw a group of what appeared to me to be quite, I mean, and I'm pretty old, but you know, quite elderly folk who are coming together in the library and taking part in sort of keep fit. And you know, the age range was really impressive. But what also I left with was the sense that they not only have they come together, but afterwards they were going off and getting coffee and having little chats, because that it's you know, one of the key problems can be isolation and what that leads to. And if we want to keep people healthy, then we're killing two birds with one stone there, and because you're getting friendships formed and people maybe, and I didn't sort of know, I suspect it does go on, but you know, when they're coming together to do that and they're having their coffee, they might agree to go for a walk on Mitcham Common, which isn't far away from Pollard's Hill, and all sorts of things, positive things can flow from that. But it was great to see, and we're doing that right across the libraries, aren't we?
Yeah, that's correct. We've got obviously we've got our termed contractor in GLL who delivers provision not just in our leisure centres but across our libraries, but also have a partnership with Nuffield Health as well. So they deliver 3 activities across all of our libraries, from, you know, chair-based exercises to keep fit to yoga as a few examples. And I think the very interesting thing about those is that the feedback we get, and the Pollard's Hill group's a very good example where numbers are regularly kind of 40 to 50 people a week, still going very strong, is that it's sometimes it's those non-traditional spaces in terms of accessing for activity are, you know, is really good, because it's local residents. There's not the kind of aura of going into a gym so much. And as you said, it's that bit of that step change in terms of activity, but also the social element as well, which works really strongly.
Jeremy? Or Luke?
Sorry, Luke.
So I just wanted to say that in terms of unidentified gaps in sports provision, recently we visited Rickard's Lodge and we spoke a bit about cycling, and a lot of young people didn't know that their school actually had cycle parking, and they mentioned that parks don't always feel safe and they don't feel confident cycling on busy roads, and that they feel like it's uncommon to cycle these days, as a lot of people tend not to. And also I believe that in terms of reaching out to other groups, perhaps looking at the Merton Youth Parliament and seeing if you could ask sort of if there's any unidentified gaps there as well, as I think it would be really interesting to see what young people have to say as well. Thank you.
Could I add in also there that we have the SEND Youth Advisory Group, so for children and young people with additional needs, and they would probably be a good group to talk to as well.
We've given you enough in terms of feeding back, so should we move on to the next?
If we can, yeah.
Yep.
It's Melissa.
Hello, my name is Melissa Stewart and I'm the Employment Manager, and I'm going to speak to Action 3, which was about enhancing local recruitment and careers opportunities. I believe that there's a video to show. Is there a video?
You want to show it now?
Please, yes, if you don't mind.
It's always a
Yeah, this hopefully will illustrate some work that we do with health.
This event's really special because for this event we've actually prioritised households with children that are living in our temporary accommodation. So we've got loads of families here, all of them are economically inactive also. So what we really wanted to do is we really wanted to make sure that the children had an amazing time.
Parents can come and their children won't be bored, because a lot of parents haven't got anyone to leave the children with. So bring the children, they can play, they can take part in activities.
We're here to let the children hold them, educate them about various reptiles that we have.
The support that we're offering here is going to really benefit their lives.
Our ultimate goal is to get them into work, but until we do that, we've got our colleagues from the JCP checking they're on the right benefits. We've got support services who can tell them about the amazing children's services that are in the London Borough of Merton and beyond. Everyone gets a hot meal, obviously.
We've got rice, we've got fried chicken, we have some gravy to go with the chicken, we've got pasta for the children, we've got meatballs for the kids.
But then there's free popcorn and candy floss, there's pancakes, we're giving out fruit.
An event like this, where it's kind of open to all families, I think has a much bigger impact.
It's important for people to realize now that, you know, we need to be out and about and to engage in all these activities, which is really helpful, especially to the families that we cater to. With children 5 years and below.
When you see someone, they look at you, they smile, they interact with you, make eye contact, it makes someone feel so much better. You could look round and see nearly every table's busy with people asking questions, wanting information, wanting advice. And there's so many volunteers from our community helping, greeting people, taking them where they want to go. And we've got young people coming here looking for apprenticeships. They can have a taste and try job.
Speaking with Caterlink there, I was really amazed to hear, how supportive they are and how willing they're willing to work with the providers, the employment support providers.
Oh, these are brilliant, absolutely superb ideas, because doing it in an area for the community and to bring everybody together, I think it's an outstanding idea.
So it's good to see that our message and word gets spread here and that people do take our message home and do apply.
FM Conway, we are a highways infrastructure company. So we specialise a lot in roadworks. We try and get out as much as we can and meet with new people, and it's a very good way of networking and meeting with new people. A lot of people don't necessarily like dealing over the phone, so I think having a one-on-one conversation with someone's really important.
Home Instead is a company that looks after people in their own home.
You don't particularly need experience. All I'm looking for is people who actually care.
You have to be a good communicator and be personable and be caring. They're the three attributes we're looking for.
Yeah. Even if you don't have a professional experience, you have a life experience. You're a mother, you look after children, you have grandparents, you have parents, so you have personal experience.
So when you come to Home Instead, you become part of our family.
So we're here to support the family hubs and children's centres within Merton and the activities that they do.
I think we're hoping that we see lots of families and they give them the information that they need, what's available in the Merton borough.
Face-to-face is very important. I think getting to know everyone within the community and kind of building that relationship.
And also because it's free, we have a lot of families that can't afford to do anything within the holidays, so that's a bonus for them as well.
I and my colleague are very excited to be here to engage with kids and to engage with adults from Merton today. We spoke to so many people. We spoke to them about the various work opportunities that are available from time to time at Veolia Merton. We told them about how it is like to work for Veolia and what sort of roles they could apply. So we spoke to some residents and we spoke to some students as well, because we offer work experience to the school students from Merton, and a lot of people don't really realize what sort of opportunities we offer. So this is a good way for them to find out what we do and how we can help them.
So I hope that gives you some sort of idea about how we're working with health and how we're working with just about any single partner that we come across and that can benefit our residents. Since Employment is a pilot employability scheme, we're very proud to announce that we've actually secured funding for the next year. So we're now going to be a 2-year pilot as opposed to a 1-year. Since our inception, we've had referral forms, and they're quite lengthy referral forms. It's information that we need. So for 537 residents, which shows that there is a demand for support for employability. What's interesting is the demographics and some of the characteristics of those residents. So over 77% identify as coming from global majority ethnic groups or BAME in old money. And a significant portion, actually over 30%, come from the east of the borough. So that was an event that we put on, and that was specifically targeting our households in temporary accommodation who have dependent children, and that was not just to tackle or try to support some of our child poverty agenda, but also to make sure that the messaging that we've got from our funders, the Department for Work and Pensions, is about employment being a health outcome. And we work really closely with our health colleagues. You will have noticed, did you notice that bearded dragon? What you won't know, there was also a huge tortoise and a snake that bit a child, but luckily we risk assessed for that. That was good. But the point of that activity was that snake, all of those lovely creatures that seem to really attract young children, that was positioned right next to our lovely Merton Health visitors. So there was a point where children congregated and their parents congregated, and it meant that our health visitors were able to give out information on measles immunisation. They were able to give out information on healthy eating. I know some of you would have drawn breath at the popcorn and candy floss, but it's half term. There were loads of healthy stuff, and I did say we gave out fruit, which we did. But it's creating an environment not only where it's comfortable and our residents can engage, but also where they can receive access to our services and information about our services in a way that makes sense to how they live their lives. What we want from you, I think, is probably the next thing. We want a lot. And I will always ask for more than I think you can give, but I think that's the Merton way, because you never know. So what we'd like for you is, especially our health colleagues, is to support us to help you to raise awareness of health issues. If there's something that you're particularly concerned about or an emerging issue or so, then we have about over 600-700 residents on our book that regularly engage with us. We send out loads of circulations, etc. And if there's anything we can do to raise awareness of that health issue, then we'd be more than happy to, but we need that information. Where engagement with certain cohorts is identified as being low, so for example, there were certain global majority groups who didn't engage as much. There was disproportionate engagement during COVID for the COVID vaccine, etc. We would really like to use that as an opportunity, not only to upskill and educate our residents, but also to increase their employability skills. How amazing would it be if those with lived experience from those cohorts actually co-designed and co-delivered your messaging to their communities? In doing so, you'd increase their employability skills, and thanks to our lovely funding from our colleagues at the South London Partnership, we can pay them to do that. So it actually benefits them in real terms as well. Mapping of underutilised commissioned capacity with regard to health resources and wellbeing resources. Merton has a large proportion of small and medium enterprises in the borough. I think in the top 3 reasons, health reasons why people are signed off work as economically inactive, musculoskeletal issues and mental health issues. So even if we do as much work as we can and we get them into workplaces, we want those workplaces to be healthy workplaces so they sustain that engagement. Not all of our small and medium enterprises can actually afford some of the wellbeing opportunities we have. However, if we're smart with our commissioning, we have underutilised commissioning services, thinking about working together, how we can actually spread that, how we can share that. And also when you are commissioning your activities, please allow us to try and inform them not only the social value linked to employability outcomes, but if you are commissioning health and wellbeing services for your employees, then the ability to perhaps share those outside of your organisations, maybe with some of our small and medium enterprises, which will also support keeping our residents' health and well at work. And then strategic encouragement, if you can, to support your teams to actually take part in our activities. We do have good support, but it's sporadic. We can't always count on who's going to turn up to our events and who's going to be there. But I promise you, everyone who turns up has a lovely time. They all get a hot meal, whether you're a partner or a resident. We encourage that because actually food is a really lovely communal way of actually having soft conversations and approaching our residents. Appreciate I've spoken really quickly, but over to you. I hope I've covered everything.
Well, I would say you've spoken quickly, but with real passion. And you know, who amongst our partners could resist your call for help? So I'm expecting to hear from them saying, "Yeah, we're going to do that. We're going to try harder." So let's hear what you've got to say, partners. Mark.
I'm pausing because there's an awful lot there, isn't there? There's a huge amount of kind of opportunity to link across. I do think in terms of when we're talking about health campaigns or what's worrying, we can absolutely link up with, you know, whether it's vaccinations, whether it's flu campaigns, whether it's prevention of long-term conditions. There's a whole range of kind of initiatives that we would welcome support in terms of getting it out there. Quite a lot of our kind of our own engagement is also kind of done with community organisations, so has elements of co-design and co-production, but I don't think you can ever do too much co-design, so we need to think about that. And then the one that I need to take away and think about is the mapping of commissioned services. Yeah, we need to, that just needs some thought as to kind of how many linkages we make and what's the priority areas that we start with and then roll out. Yeah. But yes, absolutely fantastic presentation, great video, and amazing passion. Yeah, we would absolutely take this away and link up with you outside.
Is there anything that GPs could link up with here? Again, I'm putting you on the spot.
Is that, am I allowed to speak? Yeah, I guess it's about, similar to what I said before, it's actually about awareness in advance of things that are going on so that we could then either join in and or signpost people to it. So it's about knowing what's going on, I think is what keeps coming into my mind. Obviously there's a huge amount going on, which I really enjoyed the video. I thought it was brilliant. So I guess that would be the main thing I would say, how we can publicise and also look to participate, but obviously that would have to be in a planned way, so we'd have to know in advance. It's a practical thing really.
Thank you. We actually work quite closely with Wideway Health Centre, and we will share more widely in the social prescribers. It's also worth knowing that as part of the whole Get Britain Working programme of activity and the Trailblazer programme, Merton has 2 community health link workers who are attached to our some of our GP surgeries. They're managed by the lovely Merton Connected, and they actually go out in the community and they bridge that gap between residents and actually what's happening in the GP surgeries with social prescribing and what's happening with the local authority. For year 2 of the pilot, so we've got Trailblazer funding, which means there'll be a particular focus on those that have MSK issues and those with mental health issues. There's actually been mental health support that's brought into the project, and GP surgeries will be able to refer into that. I believe there's going to be a rollout, a promotional rollout, but that's being dealt with across the South London Partnership, not an individual borough level. But I'll try and provide some more information. I'll try and provide some more information on that.
Thank you.
Tony,
thank you.
You'd already indicated you wanted to speak, but you've been invited to. So
I've been invited to by the lovely Melissa. Well, first thing I would say is that we do have 2 Trailblazers, and we have to make a number of referrals, and I'm really proud to say that Merton made the most referrals of anywhere in southwest London within that region, by some margin. And I think it's in part because of our connection with social prescribers. So what we do know is that over the past 5 years, we've had 39,000 different social prescribing interviews or appointments with people, and we know that 2 of the top 5 issues will be around finance and social isolation, and that ties back into activity. So it's fertile ground that we're digging together. We really enjoy working with it, and I want to just agree with Mark in terms of how do we map out everything we do, because I think there's more synergy.
Thank you. Can I just ask Karen, and you don't have to answer now, but it'd be really good to know afterwards, is how are we best to communicate with GPs about what's going on? That would be really helpful. And as I say, you don't have to answer now, Karen, but I'd like to pick that up afterwards to make sure we can address your proposal.
Yeah, certainly. Thank you.
Struck me as the evening has progressed that there will be, I sincerely hope there will be a whole number of bells that rang in people's heads and think, I need to follow that up with X, Y, or Z, because this is what you wanted to stimulate, and I think it's working. I mean, I suspect we could be here till 11:30, but there is a guillotine, and we do need to stick to time. Mark.
Just really quickly, I do think there is a theme about, and it's not just in this meeting, it's outside of the meeting as well. So reflecting on a conversation I had with our St George's Acute Trust, who just were not aware of the range of services and the range of interventions that are out there. And there is something collectively, I think, about us having a much better kind of directory of services that, like Karen mentioned, that everyone has access to. And it might be, maybe super online and not for people like me, but it's absolutely key because we've got some really great services and really great access points, and it would be such a shame not to sort of maximise them. So I do think that's something we probably need to take as a set of partners outside. How do we get that real directory of services and keep it up to date?
Thanks, Chair. And as Mark said earlier, I'll assume people have read this element of the presentation, noting the Chair's point about keeping to time. This actually is around being more resilient in the face of climate change. And there's a number of issues we suffer with in a borough like Merton, and two of the big ones are flooding and heat. So here are some of the actions as set out there that we've taken around flooding. Next slide, please, Megan. But what I'd really like to draw the board's attention to is actions around extreme heat, which hasn't really maybe been as the forefront of everyone's minds as much as flood risk has, but we all remember last summer, and for some people it was glorious, and for some people it was a real trial. Their homes were too hot, their environments were too hot. It just, if you suffer from anything that means you struggle to regulate your temperature, maybe you're older or younger, or you have a medical issue, that is a real struggle. So what we really like, what we've also been doing already is working with Barry and the public health team around improving the council's overall actions to tackle heat. So moving forwards, Megan, last slide there. I think the things we really want to dwell on are what we can do as a board to look at the resilient actions, particularly around extreme heat. For example, does your organisation have a plan for flood risk or heat? And is your organisation involved in any of the community actions? For example, there's a climate resilience tour that many of our community groups are participating in, which will take place over this summer. And again, it might be something for the social prescribing team to be aware of, because there's lots of different groups in the borough. And it will give practical advice to our residents around what to do in cases of extreme heat, what to do in cases of flood risk. So, Chair, I'd like to offer it back to you to ask the board if there's anything they'd like to suggest.
Suggestions from the board? Barry?
That's coming because Tara named us in that. I mean, we have been doing lots of work to pilot the adverse weather and health plan. So we worked as a pilot with UK HSA health protection teams to identify the actions that we've already been taking to mitigate the health impacts of heat and identify new actions. So we're very close to starting those planning for summer. So again, we're taking a paper to the Corporate Resilience Board of the Council to identify some of that good work that we've already got, what the findings are. Because I'm sure there's lots of people across the room might get an email probably 5 times a day when we're expecting heat, and it says it's going to be hot, it's going to be cold, it's going to be hot. What action do people take? Do you forward it on, or do you look at it and take the actions that are in the email? So there's definitely some work we can do, and we're working with the team to implement that. And again, that's an example of how we in Merton are piloting something at a national level.
And for people that work in our organisations but who go into people's homes and so on, for them to understand when heat might be an issue, so top floors of tower blocks and so on, so that they know how to sort of spot people who are in trouble or give them a bit of advice. And I think that sort of training and sharing understanding is a never-ending thing we have to do. But we have so many staff going to people's homes and so on, both in health, social care. I'm sure it's in the action plan, but it's probably for all of us to be aware of.
On that one, have we developed good links with those that are delivering home care? I mean, that's they could be our eyes and ears and kind of, you know, alert us and their service users.
We will be. Absolutely, they're on the list of those key groups that we need to engage, but including those external partners. London Fire Brigade do lots of home safety visits across the borough. They have that opportunity to have those interventions, but home care as commissioned service in the council could be a really important part of that.
Just picking up from Barry about potential role certainly that councillors can play in disseminating information from the council through to our residents in the wards. It's infuriating that we're not able to take the email from the council and then pass it through. Most of my connections are through WhatsApp groups, and I'm not able to cut and paste anything from a Merton email into a WhatsApp group. And IT are apparently reviewing the security issues that exist, but it's a really bad it gets in the way of us being able to communicate openly to our residents. And I also would, my guess is that air quality might be another area where we could get advanced. If we're aware of the fact that there are air quality issues, and certainly we've had 2 big fires quite recently, air quality ought to be another area that we could communicate to people to, I don't know, get their windows closed or something if there's a problem.
Of course, last night, or was it the night before, the people of Glasgow had an experience caused by a vaping shop, as I understand it, and one of the fires that I think you're referring to is thought to have been caused by the batteries, and so there's a really important message to get out there, and again using all the opportunities that we've got to talk to people. And advise them about how to keep safe and well.
So I'll take that as an action, councillor, to think about how we share those messages. And there is a London-wide air alert system. So, for example, in the last few days, I got a text message saying that the air quality in particular areas have changed, and it advises whether there could be health impacts. So there is a national London-wide system. Can't remember what it's called, but we will tie that up too.
Just 2. Yes, so we can move on to the other one.
Okay, please do. Yep.
Okay. Evening, everybody. So Action 5 relates to the council's additional and selective licensing schemes. Pretty fair to say that the council's always had a duty to take action against reactive complaints of repairs, but what selective and additional licensing does, it means that the council takes proactive action where to make sure landlord standards in certain areas of the borough are raised. So you can't just do selective and additional licensing without there being a justification behind it. The council had to do a lot of research to show that there was problems in the wards that are covered by it, and selective licensing covers 4 wards and additional licensing covers 7 wards. Just a little bit about what all that means. Selective licensing basically covers all private rented properties in the area, or that's covered by, in this case, in 4 wards. Additional licensing picks up houses in multiple occupation that aren't covered by the existing national mandatory scheme. So the mandatory HMO licensing scheme covers properties with 5 or more people in it. Additional licensing covers those with 3 or 4 in it as well. So we rolled the scheme out in September 2023. It's pretty fair to say that the people that apply at the front end of the scheme are the good landlords. They're the ones that probably have got less issues. However, having said that, if you actually look at what we've achieved so far, that you can see that we still have served 350 preliminary notices and 250 properties have been improved to date. And we're really keen as part of the scheme to record where we're actually making a difference. The criticism of these sort of schemes across the country is quite often that this is councils going out there to make landlords pay for something and there's not really a benefit. But this can actually demonstrate that there is a benefit for the residents in those wards. I would probably draw your attention to the final one, where we obtained 3 final management orders on 18 properties in a road in Mitcham. We're not the first people to do this in the country, but we're one of the first to do it. That meant that the council took over control of those 18 properties as if we were the landlord. So it's quite significant that we did that, and I think it sends out a strong message to other landlords that operate in the borough that the council takes it very, very seriously, whether we find there are issues. So if I'm quite honest, we're quite proud of that. As I said, if we move on to what we're doing next, as I said, to date, not exclusively, but mainly you've had good landlords coming forward. It's inevitable that there will be landlords out there that are dodging the scheme. So we'll be moving into a more proactive stage of trying to track down those landlords that haven't applied. And that's a much more intelligence-based process. So that's, members of the public will tell us. But other agencies have got a big part to play here. You may find out that there's people who are complaining about their private landlord in one of the 4 selective licensing wards, and yet they haven't got a license, and we can prosecute in those cases as well as taking action to improve those. But we'll be doing a lot around sort of searching out information that we can find on that, whether that's across the internet or, as it says here, in literally street to street surveys, particularly relating to houses in multiple occupation. We are also looking at whether or not there's a justification to widen the scheme across the borough. Again, there has to be an evidential base for that. We can't just say we're going to do a whole borough scheme either on selective or additional, but we're looking what evidence is out there, and that could mean that we expand into other wards, or indeed there could be a whole borough scheme depending on what the evidence comes back to us and shows. We're already looking at an extension of Article 4 in relation to the planning conditions for houses in multiple occupation, and lastly, we're also looking at standards in temporary accommodation, certainly in Merton. But if we look at what members could do here, perhaps to tell us, it really is, I guess, along those sort of intelligence reports about, you may come across people that are in the private sector. As I said, I'm sure you're going to come across reports of things like damp and mould. It's a huge thing at the moment. But also potentially, as we're looking at the justification across the borough to perhaps widen the schemes strategically, you might have information on that you could share with us. Happy to answer any questions.
Firstly, I'd like to thank Elliot for his hard work. We know from social prescribing that 1 in 5 referrals relates to housing, which is quite impressive. The other thing I'd like to say is that we know from our work with the community health and wellbeing officers on Pollard Hill, on Pollard Hill, where I worked there for 2 years, that HMOs are a big issue. And in fact, we did discover one, and we did refer it to you, Elliot, and you did work with us on it. So yeah, I think it's a really important piece of work, and thank you.
It's nice to get a bit of positive feedback at the beginning of the proceedings. I would like to know, and it may be Karen again, and I'm sorry to put you on the spot, but if somebody's sort of coming to their GP and their kids have got problems that are caused by damp and mould, is there a clear mechanism through which the practices can alert Elliot and his team? I hope that exists, but I'd like to know.
I wouldn't be confident to say there's a clear mechanism. I mean, I think the first thing, obviously, clinically, is to make the link between maybe the child's poor health and the housing. Quite often, families will sort of show photographs on their phone of sort of damp and things, which obviously then helps you to understand better their sort of their living conditions. I guess probably yes. Then what one would normally do then is to look up on the website how to make the referral. But from the point of view of that being commonly known across all relevant healthcare professionals, because for instance, it may not come through the GP. It could be, say, a practice nurse doing an asthma review, or a clinical pharmacist, etc. So I think it's another area where we could improve awareness and improve referral routes. I believe there is a referral form that we have to fill out in order to contact the housing department. So yeah, it's making sure everyone's got that information, you know, at the point that they actually need it.
Yeah, there is something called the duty to refer.
That's
sort of
right.
homeless
Yeah.
persons legislation. So
Yeah.
it should be, yeah. So so anyone can from another agency can use the duty to refer. And that tends to be around a sort of a homelessness context, but we would pass it on. We also do get a lot of inquiries from social prescribers around housing issues. I know they write, a lot of them write direct to me, so I'm very familiar with them all. So yeah.
So what would be really good would be to have a really sort of clear and simple route in. I think that would make a huge difference. So maybe again, it's something we could take offline and just, I could do a little bit of research around my colleagues about what they would do in that situation and how much information they are aware of. And then I think if we can come up with a simple referral route in, that would help everybody.
I think that would be great, and it's another example of, you know, the conversation that we're having here stimulates action, and action, you know, that continues and improves the lives of our residents. So thank you, Karen. I appreciate that. And the other thing, I keep coming back to it, is, you know, the integrated neighbourhood teams are going to produce more and more conversations of this nature, where people are working together in teams more frequently. They start to build trust and confidence in one another, and you know, and it just happens because they are there and they are cooperating together. Usama.
I just wanted to add that an additional action here should be around empowering residents and particularly tenants with their rights, especially in light of the new legislation around tenants' rights. Elliot will know that one of the top issues residents come to me and a lot of councillors about is housing, particularly people in poor quality housing that is out of the control of the local authority, which is a lot of our housing stock. And when you have a housing association, and there is one notorious one in particular, which is quite slow in responding to residents' concerns and needs to be pushed again and again and again, we need to do everything we can to not just help them on our end, but empower our residents with what their rights are. And so they're not living in conditions which are a health risk. And quite frankly, some of the issues residents flag with me are pending health risks, and you can clearly see the health risk. But when it's out of your direct control, it's about pushing the housing association. And so we should add within this an action for all of us to ensure that our residents are educated on what their rights are, so that they keep pushing for the quality housing that they deserve.
Barry, let you go first. I think you had your hand up first. So.
Thank you. Just to pick up the damp and mould, so we've been doing some work with the Regulatory Services Partnership on damp and mould in direct response to the entirely preventable and sad death of our Abhishek, who died from asthma, which was exacerbated by damp and mould in his social accommodation across, not in Merton, but in London. So we've done some awareness raising and training of how to raise awareness and what actions people can take. And we also know that Awab's law is either just about to come in place if it hasn't already. So it's definitely something we've already got on our health protection work plan. And again, it's something that with the RSP and Elliot and Public Health, we can work together on that piece of work, because that coroner's report is incredibly sad and distressing reading.
Mark and then Helen.
Two things, just totally agree. Integrated neighbourhood health is not it's not just social workers, GPs and district nurses. It needs to include housing, welfare rates, etc. So that actually we are addressing people's complete needs, not just one or two. I think the other thing is just, I'm sure you are part of it. So there's the South London Listens kind of housing coalition, which has lots of Merton organisations. And just in terms of what we're hearing back from residents about what their issues around housing, whether it be with a housing provider or whether indeed it be with a GP and getting a letter to support you in your housing application. It's just, again, it's joining all these pieces of work up, isn't it? Yeah, so that we're not doing things in isolation.
And then I think we need to move on because we're already running behind.
Thank you. Just to support what Barry said, we'll be working in public health with you and now Karen and colleagues as well. And just this morning, the respiratory and paediatric paediatricians have flagged this as well. They'd like to join in, please. So just for you to know.
Russ, I can't refuse to allow you to speak on this issue.
Well, it's the final item, but it just strikes me that with the integrated neighbourhood plan, some of the governance and changes to the Health and Wellbeing Board that are being suggested by government in the future, we're still awaiting final guidance, is that this board signs off integrated neighbourhood plans. And it just strikes me from the conversations today that I think all of the SROs of the 5 themes should be involved in that process in the future in terms of signing that off, so that we can ensure that wider determinants of health like housing are prominent in those neighbourhood health plans.
Thank you. I'm sure the SROs will welcome the additional work that you are suggesting. But I think it's more than just a sit. But I actually think, having spoken to them, that they will, and they'll find at the time, because they recognise the importance of it. So we need to move on. Octavia, are you?
It's me on this one, I'm afraid. Katie.
They're not.
Yeah, and I'll be really quick because Katie is not able to be here with us this evening, but she's sent the slides in advance, so I hope you've had a chance to look at them. I think the really key things that we've delivered here is the Safer Streets neighbourhood wardens, and some of the statistics included in the slide speak for themselves. And the council's also adopted the violence against women and girls strategy, and we're taking very seriously the serious violence duty. So I won't go through the numbers on the slide for the sake of time, but I think it sort of stands for itself. So what we'll do next is we intend to roll out more of the Safer Streets neighbourhood wardens team. So that's proved very successful, and we're keen to expand that and work with partners in expanding that, and of course implement the actions in the violence against women and girls report, and the delivery plan for serious violence. So on the final slide here, what can we ask, or what can Health and Wellbeing Board members do to assist? I mean, we heard earlier from Tony and from colleagues here about young people and older people feeling safe in their environment, so we really understand how important this is, and we're keen to understand from you board members what else we could be looking at doing to improve.
That I've raised previously with the neighbourhood. It's important that they are seen in all our communities, and I know that there are some schemes run by housing associations, one in particular, but just because they're there doesn't mean that the people who live in those estates, those areas, aren't entitled to the support of neighbourhood scheme. So that's a very important message, because I think when there are particular problems, the two working together in partnership, which is what so much of what we're doing tonight is all about, is more likely to achieve success. Barry.
Thank you. And again, it's work that we're already taking, but working really closely with the wardens on our response to synthetic opioids. So delivering harm reduction messages, and we've included in our work plan that's going to OHID for approval, the funding for a drug and alcohol worker to be embedded within the wardens programme, so we can deliver interventions where they're most needed across the borough.
I like to think that if there are problems that come to the attention of our health colleagues, that they would have, again, a mechanism through which they could report concerns that patients were bringing to them or were having an impact on their own health and mental health, or from neighbours that are just unbearable to people threatening folk and making them fear for their safety. Are there?
Yeah, I mean, certainly, if we're looking around kind of serious violence, etc., so all health organisations will have safeguarding policies, procedures, etc. So actually, if they come across that, it's a must do. It's not just I've recognised it. Actually, they have a statutory duty to report that and put it through the system. I think just in terms of I suppose when we talk about the strategies around serious violence and violence against women, where do they? And I should probably know this. What forum governs that? Where does that report into apart from the health and wellbeing strategy?
There's a community safety partnership, which
we're part of.
Yeah.
I just wanted to ensure that we were a health web partner.
The comments or suggestions? Yes.
In regards
Sorry,
to
when I asked you to speak, invited you to speak earlier on, you didn't introduce yourself, and I think there may be some people who don't know who you are and what your role is, and I think it's important.
apologies, my name is Nicola D. Silva and I'm a public health young inspector for Merton. So in regards to the new violence against women and girls strategy, I would like to ask, is there any opportunity for young inspector involvement? And also, we're interested to hear more about the findings as well.
I worked with our officers who are focused on the tackling the violence against women and girls, and a large part of the new strategy is around prevention and starting at a really young age, because the theory, and this is based on the feedback that we got when putting together that strategy, is that if you can start at an early age teaching and promoting healthy relationships, that will then stem a lot of those challenges later on in life. And so a large part of the actions are around going into schools, speaking with young people, especially boys, around issues like toxic masculinity. And we've been working with an organization called VoiceBox, which has these young facilitators that go into schools and youth centres and deliver sessions with your young people to promote those healthy relationships and to push back against toxic masculinity, but in a way that's not talking down to them or telling them they're wrong, but encourage them to reflect on what a good relationship is. So all of this to say that a large part of the strategy is focused on young people, and there are opportunities for young people like yourself that want to be involved and promote that strategy to play an active role. And what I can do is I can connect you with Zoe and with Dawn, who are leading on the strategy, and they can give you more specific opportunities for you to get involved, because there's going to be a lot of activity around engaging with young people in the coming months and years as we deliver on this strategy. So I'm glad that you're interested, because the more young people we have, the stronger our chances of tackling this issue in the future.
Thank you, Chair. Thank you all, colleagues, for waiting with me. That's very touching. I think it's really nice. Thank you. So I've got a couple of slides on what the outcomes are that we have achieved so far. If I just run you through what we've been doing on the cost of living. So in June 2022, Merton became one of the first local authorities in the country to declare a cost of living emergency. The council immediately mobilised resources to deliver a borough-wide emergency response. In 2023, the council launched its cost of living strategy and action plan, seeking to provide strategic alignment to existing and future activity to support residents based on 5 priorities, which you can see there, and which it's important to note. These 5 priorities were discussed and devised and agreed on at the Merton Partnership Summit that we held in 2022, where a lot of you will have been present as members of the Merton Partnership and this strategic board in particular. And so those priorities are food insecurity, energy efficiency in homes, finance benefits and debt, jobs and skills, and next generation. And by working closely with the voluntary and community sector and across council services, a lot of my colleagues in this room providing frontline services and insights into how the cost of living is affecting our residents, we've been able to guide support to those most in need. Next slide, please. Thank you. So since that declaration of a cost of living emergency, actions and initiatives have been funded by the council's £3 million cost of living support fund, but also incorporating elements of the government's household support fund, supporting residents in several ways to alleviate the financial burden facing them as the cost of living continues to rise far faster than wages. So some of the initiatives have been pulled out here in terms of the numbers of people that have benefited from them. Taken together, the funded initiatives have provided a balance between direct grant support to residents, emergency support delivered through the voluntary and community sector, and initiatives that reduce costs. Initiatives have been co-funded from other sources or have moved from cost of living support fund, household support fund to other sources. For example, many initiatives now sit with public health and adult social care in order to be continued to be funded and supported. As with support for the borough's voluntary sector, funding for several cost of living related initiatives for residents remain a priority across the council as a whole. So there are a few examples there, and if we just, I'd just like to go into a little bit more detail on, for example, the cost of living events, because that's an element of the work that's been running for as long as all of the cost of living specific work has since that emergency was declared. So since July 2022, we've run a series of cost of living events out in communities across Merton. And by working with partners, these events have been an effective mechanism for signposting people, including those who are digitally excluded, to the right information and advice and support. with the offer of a £10 supermarket voucher to each attending Merton household as an incentive. These events have predominantly been delivered from our libraries, but have also been at the Civic Centre and at the Acacia Children's Centre. So there have been 22 events overall: Mitcham, Morden, Collieswood, Rains Park and Wimbledon, and a total of more than 5,300 residents have attended those events. 25 local VCS partners have been regularly attending to have those advice stalls, and also supported by 10 council services regularly giving advice on council tax and housing, family hubs, public health, and social care. These events have also regularly had COVID-19 and flu immunisation workers there giving jabs to residents. So that's been a really good added kind of bonus to these events in order to incorporate a kind of direct public health opportunity at them, particularly considering the numbers of people who are attending. Citizens Advice in Merton have said that the events have helped them reach a completely new client base. They're seeing people that they don't see coming through their doors, that they otherwise have some difficulty ensuring that they're getting that advice and support too that they would want. And just a couple of quotes from residents, because we have feedback forms. I'm going to choose a couple. Really good for the community. Every little helps, especially now when the cost of living is so high. Thank you for helping us. All your team members are so kind and helpful. God bless you all. So if we move on to what do we want to do next? So in the, I beg your pardon, I'm Octavia Lamb, Head of Policy, Strategy and Partnerships in the Corporate Centre of the Council. So in the Policy, Strategy and Partnerships service, we are now working with colleagues in the delivery unit and with colleagues in children, lifelong learning and families to develop a child poverty strategy, which is one of the directions that the cost of living work is kind of moving into. That strategy will, you know, we're looking at aiming to tackle the root causes and alleviating the symptoms of child poverty with a multidimensional approach, given that the drivers and impacts of child poverty are multifaceted. I'm sure everybody in this room would agree. We had started to, well, we have drafted a reducing inequalities and supporting families strategy, which is a kind of new version of cost of living, a broader cost of living strategy, in order to follow on from the one that I've been talking about so far. So that's in the works to run alongside that child poverty strategy. And to, yeah, we're going to sort of, we're redrafting that at the moment to ensure that it aligns with the priorities of the council and of its partners. I'm also working with colleagues in licensing, because there was another element to this action about licensing duties, and as we progress the work on cost of living, we really want to work together to explore the links between alcohol-related harm, gambling impacts and poverty as part of that work as we go forward. And so then the final slide, thank you. So yes, so what would be really helpful this evening and going forward and in future meetings and at Merton Partnership meetings and so on, is input from you on what you view as the priorities regarding the cost of living. How best can myself and colleagues engage with you going forward on child poverty work would be really helpful. I mentioned earlier the Merton Partnership Summit that we had in 2022. They run every 2 years. And now I'm drawing a complete blank what happened in 2024, but we've got one coming up this summer. So that will be focusing on developing a new community plan, but we will also have a focus on that child poverty and cost of living work, just as we did in 2022 in terms of helping devise that cost of living strategy. So hopefully everybody on the Health and Wellbeing Board and in the wider partnership will continue, as you always have, playing a huge role in that summit date to be confirmed. But yeah, thank you.
Thank you. Tony.
Can I ask, to what extent do we think there's a lot of stuff going on below the radar, as it were, that we're not picking up? So to what extent do we need help in finding people who have problems, rather than what it is we're going to do with people when they come forward with problems? So I would have thought that's quite a challenge.
Yeah, thank you, Councillor. That's why the work that we do with partners is so important, and those voluntary and community sector partners and health partners out in communities. And certainly one of the things that we want to get right with that child poverty strategy is making sure that we're linking all of these opportunities that these different services and different players out in the community, making sure that we're linking those up and not missing any opportunities to help residents that the council might miss or a voluntary sector partner might miss, and ensuring that we're kind of continuing to have those, sharing that information.
Do you want to respond to that?
Yeah, I think it's a really important point, and you mentioned gambling in particular, and there's a new gambling levy that's going to kick in, and we will get funding via a Section 31 grant next year. Public Health will, for gambling specifically. We don't know exactly what our allocation will be, but the early thinking is to do a needs assessment of gambling harm in Merton. But as you say, a lot of it is under the radar. So there are some metrics that indicate gambling harm for adults, but the impact on children, there's no metrics for that. So I'll be keen to sort of get in touch, because we will be putting a paper to CLT to try and outline for gambling specifically what we would do in the future.
Helen.
Thank you. There's a really interesting approach called poverty proofing, which is about talking to clients, patients, whoever, as if they may be in poverty but don't want to declare it for some reason. And there's a whole movement for this, which has really started in the north of England, but it's starting to sort of spread throughout the country, and it might be something that we could look at.
I'd just like to say our council colleagues are excellent at communicating with us when they're ever putting on any event or discussing anything or looking at new things. So Barry's already highlighted that gambling might be coming our way in some shape or form. And I'd also say that Merton is a fairly unique borough in that so many of the voluntary groups and the charities are small, and that they form out of a sense of feeling what's happening now. So quite often we kind of get a spider sense of what's happening before other people do, and I think we're good at linking that in. But we're not perfect, but there's good work being done.
They're an interest that because I spent 40 years in the third sector, and I've attended most of the cost of living events, and I've helped distribute food vouchers, including when we shopping vouchers, including the famous time when we ran out because we were overwhelmed by the sheer numbers attending. But what that has demonstrated, every time I go, I spend time just wandering around talking to particularly the voluntary groups and sort of finding out what they're hearing and what they're seeing and thanking them, because we have such an amazing voluntary sector in Merton. I knew about that from my days way back when, if you look at the picture out there, when I was a very young mayor of Merton in 1990-91, but it's still as vibrant then, and there are so many good people. And I was at the Food Response Network meeting, because that's one of my responsibilities in the cabinet for food poverty this week, and I am just so astonished at the huge contribution made by the different groups wanting to meet the need and work together and find the gaps and plug them. And it's a credit to the borough and to your leadership of those voluntary organisations. So thank you. Please pass my thanks on to them.
In terms of the best way for this board to engage with the child poverty strategy that's being developed, what we found already working with the delivery unit is, and this is not going to surprise anyone around this table, but one of the key consequences of our families living in poverty is poor health outcomes. And so a lot of the pilots that we're launching to look at what is the best way to lift our families out of poverty and improve those health outcomes is around things like good nutrition that is with ingredients that are affordable, because of course we all know the unhealthy stuff is incredibly cheap, and good quality ingredients are beyond the budgets of a lot of our family, and using that as a way of also tackling the additional problem of childhood obesity, particularly with 11-year-olds who are about to leave our primary schools. And so as this strategy develops, a key role for this board to play is around sort of accountability and tracking the impact that the work of the delivery unit is having. Because one thing that we're really good at here in Merton is we have a number of initiatives support our families, like all the initiatives you just went through, the cost of living events, which are all a good thing because our families need support, and so they need these interventions. But we could be better at measuring the impact of all these different initiatives. And I think we've got an opportunity here with the child poverty strategy, where we know some of the key challenges our families in poverty are facing and how we're trying to address them, but we want the data to back that up so we can scale up the pilots and initiatives that are working, and we can think differently about anything we try that isn't getting the outcomes that we want. So we can look at how to get the board involved in holding those pieces of work to account.
Any other comments on this part? Please, Jeremy.
Well, firstly, thank you very much to all the board members and to staff members who presented, and I really appreciate the board's time on this. Obviously, it's taken a long time, but you've been very patient, but your input has been really valuable. I've got some pages of notes here of things to take forward, so that's really positive. I think what I wanted to say was, as I said at the beginning, I appreciate how important this health and wellbeing board is. And I think you've actively demonstrated tonight, although we do lots of great stuff, there are still things we can look to do and improve. And I hope you can see that on the healthy places theme in particular, we've moved from just a plan to some real actions and some really tangible changes. So just thank you very much, and we're here to help drive us forward to the next stage. So thank you, Chair, for hosting us this evening.
Don't think I've ever allowed a meeting to finish this late since I've been chairing them, but I also believe that we could have spent considerably longer, and I'm really pleased that there are going to be some follow-ups going off in all sorts of directions, and I would encourage people to do that and keep thinking and keep working to make things better. And I think it's been a really productive discussion, and people have contributed very well, and I'd like to thank everyone. But I do think we need to move on. So the next item is joined up services, and that's highlights for in preparation for the next meeting. Mark, you kindly agreed to.
Yeah, so I'm fielding this, but I suppose in the interests of time, I'll be very, very quick. And we also have invited Camilla from C3, who's supporting the work, to just briefly update us on integrated neighbourhood team development, because as you see tonight, it's been mentioned a lot of times, there's a lot of opportunities, but just to be to manage expectations, we are at the beginning of developing our integrated neighbourhood teams. There's lots of great joint working going on already, but actually it's now about starting to formulate it into something pragmatic. So I'm going to hand over to Camilla just to give us a brief, very brief update on the integrated neighbourhood team progress.
Thank you, Mark. So I'll give a brief update. So over the past 2 months, we've been working with partners across the system, with both SROs and design leads, to start designing what does an integrated neighbourhood team practically look like in Merton. We've defined what Merton's ambition is in the now and the next and the future, and then we've actually started developing what that initial design looks like. And we'll be sharing about SROs in the next couple of weeks, that initial design, so we can continue to iterate and develop that with them. Our 2 key next steps. First is to start that next level of design. So we want to get to the stage where someone can start doing this practically day in and day out. We're still quite far away from that, but it's very much to get the next up to design so it becomes really real. And then the second key step that we have is to start mobilizing our test and change sites. So these will be sites where we're going to start actually testing and understanding how can this work in practice, what works, what doesn't work, so then we can have a full model that we can roll out to the borough as a whole later on. That's it.
Just add, in terms of the design phase, when we talked about actually what services needed to be wrapped around individuals, absolutely things like housing, welfare rights, etc. were part of that conversation, but that will be a kind of developmental piece as we go through the structures. Just going back to the other, there are 9 actions that we're bringing back in June. For the interest of time, I'm not going to go through them too much now, but just to say there is some really great work, particularly going on around things like cultural competency in organisations. Certainly the borough are doing a lot there, as are South West London and St George's. There is quite a lot of links across to things like physical and social activities, and we've heard some of those tonight, but the Borough of Sport also plays a big role. The young inspectors, fantastic work, and fantastic to have them in Merton. What we're really keen to do is actually, they're becoming more embedded in the council and everything that the council do. Actually, how do we kind of perhaps borrow you across into health and actually have a kind of Merton across the board young inspectors that are looking at health services as well. We've got a review of mental health governance underway, and also the pathway of really complex patients for mental health. We've recently just the borough are commissioning a brokering placements on the ICB's behalf for really complex patients, and that's going again, joining up what we do and how we do it, rather than arguing about who pays for it. New service models. I believe at the OSC there was quite a lot of talk around dementia and dementia plans, and actually in dementia there's quite a lot of interesting pilots which we will bring back, as there are in terms of primary care. You know, we've got a respiratory pilot, we've also got the local authority falls pilot, so that there's a lot of new work going on. I'm exhausted just talking about it. And then finally, I think just in terms of people with learning disabilities, we know they're the most vulnerable, often the most vulnerable patients and residents we have. And actually, what are we doing around support, accommodation, but also the pathways that they have, because they can often be very complex and not fitting into one category. What we can see is often they fall between services, or actually it takes longer for them to access services. And what we want to do is ensure that we are addressing that. There's lots of great work going on, but actually it goes back to the mantra of this evening. I think we need to bring separate pieces of work together and actually do it in a much more joined up way. So that's just a taster for what we'll bring in June. Oh, and one final one, which I'm sure Councillor McCabe, we shall also bring an update on estates.
Glad you said that, because I was about to ask you. Karen, would you like to add anything from the GP perspective?
No.
Are you happy with the way it's moving?
I'm very happy, yes, and actually I'm a member of the INT design group, so that's quite exciting to be involved in that and see how we can all come together and work differently. So yeah, no, I think there's lots of interesting things going on.
Thank you for the work that you're doing on that, because so much of the discussion we've had tonight indicates the importance of that work, and we're grateful to you for cramming that into your very busy schedule. So thank you.
You're welcome. Thank you.
Thank you, Chair. So I'll try and be brief. So when our strategy was launched last year, it contained a one-year plan in the back of the strategy that runs against each of the 5 themes. So the first theme, Start Strong, started in September, and it goes through to well, Mark's update for the joined up services in June to come. Between now and June, we've set up a series of meetings with each of the SROs for the 5 themes to review year 1 plans and help us prepare a year 2 plan for board. Some of the discussion tonight, for example, will have informed, I'm sure, the thinking around healthy places. It's intended then that these plans will be collated and brought back to board for June for board's endorsement. It's likely that some actions will continue from year 1. So for Start Strong, for example, child poverty will, I'm sure, be taken into year 2. And tomorrow we've got the education conference for CYP as well, where I'm sure that will help inform that theme, for example. Alongside this point, I also need to flag that there'll be imminent changes, as I mentioned earlier, with guidance of the board. So the way the board functions will look slightly differently in future, and we will need to work with democratic services on that. Government guidance hasn't been finalised, but as I mentioned earlier, it's highly likely that this board will be a decision-making board in terms of signing off neighbourhood health plans. So we need to think about that for the future, and so I'm suggesting that we have governance type discussions now and bring back a report in June once guidance is out. I think that just tallies well with the theme for June as well, joined up services, where the neighbourhood health plans will be a core part of that theme. Because our strategy is based on wider determinants of health, and healthy places today has highlighted the importance of this, it is proposed that we still focus according to our strategy on that 80% wider determinants. So it's not that anything new will, like, you know, we won't be taken over by a kind of clinical based strategy moving forward. So the intention will be that we will continue to run as the 5 themes each per year, for the 5 meetings per year. But it's likely that by exception, because of the importance of the neighbourhood health plans, that they will need to be more frequently aired as we go along through each year. Thank you.
Thank you, Russell. That's really helpful. Any questions on that? Okay, well, we'll note that report, and I would like to apologise for keeping you all. I think we've reached the end of our agenda, but it has been a very productive meeting, and I'd like to thank everyone for their contributions. And if you could thank your colleagues who presented, because some of them are quite right. They've actually gone home to their families. And I think we should join them. So thank you all for coming, for your participation, for your contributions, and the meeting is